Welcome to the deep dive. Ever wonder why some health plans seem to work out while others just fall flat, even with good intentions? Today, we're digging into something really vital, but often kind of invisible. We're talking about the subtle, powerful forces shaping our healthcare systems, our policies. It's about power.
Yeah.
And understanding how it works, well, it's not just for academics. It's absolutely crucial if we want to improve health for everyone globally.
Absolutely, yeah. It's often this unseen force, isn't it? It shapes how policies get made, how systems actually work day to day. But, it's surprising how little explicit analysis of power there's been in health policy and systems research. HPSR, as we call it. So our deep dive today, it leans heavily on this really pivotal guide that's trying to fill that gap. Gives us a solid starting point for, truly getting a handle on power and health.
Okay, right. So the guide defines power pretty simply. It's like the capacity to do something or act in a particular way, and also to direct or influence the behavior of others. Okay, but why is looking at this in healthcare so often missed? It feels like it should be front and center, doesn't it?
That's a really good question. What's fascinating, I think, is that when you do analyze power, you start uncovering the root causes, the mechanisms behind social inequities, those stubborn health disparities we always talk about. Imagine, like you said, policies that keep failing, good intentions, but no results. Well, analyzing power can reveal that hidden struggle, that tug of war happening underneath. It shows us why things aren't working, and maybe, just maybe, how we can actually fix them. It puts today's problems into a bigger picture, historical context, political context. And that helps design better systems, better reforms, hopefully.
That really clarifies it. So this guide, it suggests a framework, 3 main areas, or empirical sites, as they call them, where research on power in HPSR can really zoom in. First up, actor relationships and networks. So who are the players? Which people, which organizations are influencing decisions, and how do they interact? You could think about, say, the dynamics inside a hospital, the administration versus the frontline staff, perhaps, or even like global health bodies and local governments. Who's really pulling the strings, and how do those relationships change things?
Exactly. So once you figure out who the players are and how they're connected, the next big question is, where does their power actually come from? It's kind of like asking, what's fueling their engine? Where does the influence originate? Is it money, material wealth? Or maybe it's technical know-how, expertise, or their political position, being in government, say, or maybe even their education, their knowledge base. It gets into the real sources of that influence.
Okay, so we have the players, their connections, and then where their power comes from. What's the third piece?
The third one is about societal flows and expressions of power. This is broader. It looks at how power sort of flows through society and affects health outcomes. It helps reveal how maybe formal institutions or just dominant ideologies shape everything, from the big policy decisions right down to how services are delivered. And often, that's where the inequities really take root. This even helps us understand how history, like the legacy of colonial medicine, for example, might still be influencing health systems today. It's powerful stuff.
Wow, yeah, that's a big scope.
And there's another crucial point the guide makes. It's not just about looking outward at power dynamics. Researchers, we, are part of these dynamics too. This brings in positionality and reflexivity. Basically, it means researchers need to really think about their own background, their biases, their role in the whole process, from start to finish. It's vital for doing ethical work, rigorous work. It takes more time, sure, more thought, but it leads to much richer insights.
That's such an important point, self-awareness in research. Okay, so listening to all this, I'm thinking, what does this mean for you, our listeners? How does this framework actually help us make sense of things? It sounds like it's giving us a toolkit almost, a roadmap.
Yeah, I think that's a good way to put it, a roadmap. The guide shows how you can connect a specific question you might have, like, why are health outcomes worse in this community compared to that one?
Yeah.
Connect that question to foundational ideas, theories about how power works. Maybe it's critical race theory, maybe feminist theories, others. And then pair those theories with the right methods. Is it a deep dive case study, talking to people, or maybe mapping out social networks, who knows whom, who influences whom, or maybe even using big data analytics to spot patterns you wouldn't otherwise see?
So it helps you choose the right lens, the right tools for the job.
Exactly. And ultimately, doing more research like this, focusing on power and health policy and systems, it's just vital. It's vital if we want to get at the underlying causes of health disparities.
Right.
If we want to build stronger, fairer health systems for everybody. It's really about generating new knowledge, new insights, aiming for a more just world at the end of the day.
A more just world. That is definitely a powerful thought to leave everyone with. So here's something for you to consider. How might applying this lens, thinking about power, change how you look at health news, or interpret policies, or even just understand those everyday interactions you might have within healthcare settings? Something to definitely mull over until our next deep dive.